Good afternoon, everyone. My name is Haley Heisler, and I'm a senior here at UK studying Integrated Strategic Communication. Today, I am joined by President Eli Capilouto, and we're going to talk about UK's efforts to keep campus safe this spring. So, President Capilouto, thank you so much for joining me today.
Haley, I appreciate being your guest.
All right, well, we'll start with a question that's appropriate for a university setting. What did we learn from fall semester that prepared this institution for the spring?
I'm proud and grateful for a heroic effort. We started planning that really in March when we sent everybody home. And we knew we had to develop a modern public health system that would have sort of real-time screening, testing, tracing, the ability to isolate someone who's infected, to quarantine those who had been exposed. That's the way you could stop the spread of this virus. We had cases, we managed them, we had an integrated data system. I think we did a pretty good job. We had good health behavior messages. We wanted to make it easy to be safe. I know it was so difficult for everyone, but I think we kept our campus safe. We don't have any cases that came from classrooms. Our fields of competition in sports were safe. Our treatment rooms, exam rooms, surgical suites, those were safe. We learned that our vulnerabilities are just like everybody else. When we move away from those controlled environments where we're really thinking safety, let our guard down, gather in groups, don't wear a mask, don't maintain our distances, that's when we have cases.
I think everyone's been so impressed by how smoothly it's run, and we're just very thankful for just the effort that the university has put in to keep our community safe.
Well, excuse me for interrupting, but I have to thank our students. I live on campus, so I'm out at times when maybe the cameras aren't. Not an easy weekend during a football game where you're going to find some people getting together. But I am so impressed and thankful for the way our students have shown their citizenship in masking, distancing, and everything we've asked them to do.
That's great. So you communicated with UK employees yesterday about COVID-19 vaccines and the move to the 1C phase of distribution. What does this mean for our community at UK?
So the 1C is the third category. This is in alignment with what the state says are the ways we should go. So certainly 1B included K through 12 teachers, those over the age of 70, first responders, healthcare workers, and so forth. We have done a miraculous job at Kroger Field vaccinating nearly 3,000 a day. That is, I think, the highest productive facility in the state. And we do it efficiently, not long wait times, able to get an appointment in advance. So I'm so proud of the teams that came together to do that. So now we're approaching 1C, which gets down to essential workers. And it includes higher education employees. So that means more of our campus will be eligible for this vaccine. We still are asked by the state to set priorities within those groups. For example, those over the age of 60, where the likelihood of a bad outcome is greater, or those who may be below the age of 60 who have particular health complications which make them more prone to the virus.
I think that's very exciting, and our community feels so supported because of the vaccines. So when can students expect to be vaccinated?
So students are in the 1C group as if they are essential workers. And we do have essential workers here. Those students who are what I like to say, student-facing, frontward-facing, RAs, those who advise or tutor or so forth, as employees, they would be eligible. And we also have, certainly, and some of these have already been vaccinated, students in our health colleges that have patient contact. Many of them have been vaccinated.
Right. So at Kroger Field, across from the vaccine clinic, there's another large operation underway related to COVID-19. That is, of course, COVID testing. Can you explain UK's approach to ongoing student testing and why it's necessary?
Yes. So testing is the only way to track this disease and its spread. And just as we did last semester, we tested everybody on reentry. Why do we do that? We welcome students from 120 counties, 50 states, and 100 countries. We know that the virus can hitchhike across the world or across campus in a day or in minutes. So we thought it would be good when everybody was returning, fulfilling our responsibility to our internal community and the Fayette County community, that we get a read on who might be positive, quickly get them into isolation if necessary, and quarantine those that have been exposed. So that's the reason we test. And then we'll have follow-up testing, surveillance testing, to closely monitor this.
I think that's another huge reason why students feel so comfortable at UK is because we know that testing is so readily available.
Well, I'll thank our students for their cooperation. I know it's not a fun test, but again, make me so proud. It's an example of their citizenship.
So as you think about maintaining in-person teaching and other operations, what kind of factors are being monitored to ensure it's still safe to have people on campus in person?
Well, just as last semester, when anybody tests positive, and by the way, 25% of our cases are people who self-identify, who may have gone home for the weekend or gone to a local drugstore and got tested. I'm so pleased that they volunteer that they're positive. We have complete services available for them in terms of emotional, academic support, medications if they need it. They can stay safe, not miss a thing, quarantine for less than we thought the number of days than last semester, thanks to our research. And that has been so vitally important to keep the community safe. We also, through our contact tracing, understand who you may have exposed, when, and where. And we have traced above 6,000 individuals. And earlier when I said those data reveal that classrooms, for instance, are safe, that's how we know that.
That's great. So what resources are available for students' mental health and well-being during this time?
Yeah, this admittedly has been what I think is a serious consequence of this, not just for our students, but our faculty and staff too. We were not wired, we did not evolve to be in isolation or lonely. And all this physical distancing has created this. And I see it and I feel it, and I've certainly felt it personally. So one of the things that I'm pleased that we started with Health Corps as a means to, test, trace, and do those kinds of things. But it's evolved to be an even greater resource that I direct students to. You can email UK Health Corps at UKY. You can look them up. And it's a phenomenal resource that can take information regardless of the needs and direct people to the right resource.
I know Health Corps is doing a lot right now, so we're really appreciative of that.
Yeah.
How long do you anticipate students needing to keep wearing masks?
Well, I think your mask should be something that you keep on your fashion statement list for a while. Vaccines are going to give us a break from all of this. We also have learned that this virus is smart and mutates, and in some respects can be transmitted more easily. we also know thus far that some of the vaccines still show effectiveness in preventing serious illness, which is important. People may be coming down with this in the future, but that you are able to make certain, even more certain, that people don't get seriously ill is an important breakthrough. But we also know that the things that have worked, and that is masking, distancing, proper hygiene, those are going to be with us for a while, and they're not that inconvenient. Hopefully we'll be able to gather a little more closely, not as distanced in the future. But for right now, we just need to be careful.
It's our new normal.
It is.
All right, so finally, I've noticed a phrase that pops up often in your emails, and that's a community that cares. So can you elaborate on how the University of Kentucky is showing their care for students during this time?
Yes, I see this manifest in so many ways. I hear it from our faculty who expressed to me the concerns for our students, academic, but emotional well-being too. I see it in the advisors and counselors I talk to, those individuals who wake up every day, the first thing on their mind is the well-being of our students. I see it in Health Corps. The administrative team that I work with almost daily. I like to say they're putting students first. Everybody's putting students first. If it weren't for students, we wouldn't be here. So I am inspired by our students' persistence and resilience. We are moving in a phase that many are calling living after COVID versus living through COVID. And I don't think that's just going to be a time to throw up our hands and celebrate and move on. There's some consequences of living through COVID. Academic, emotional. One of the things that college offers is that time to socialize and take those steps into adulthood. And I like to say, at least for me, college was a wonderful time to make mistakes and learn from them. And, we haven't had that full opportunity during COVID. And I think our faculty and our staff know that and look forward to how we can accelerate out of this to provide that full opportunity that was available before COVID.
Definitely. And I know I've certainly felt the care of our faculty here at UK, and I know that my peers have as well. So I think that's all we have for today. But again, thank you so much for joining us, President Capelouto. I know it means a lot to our viewers and our community that you would take time to answer some questions for us. And thank you all so much again for joining us.